Good afternoon, everyone. Thank you so much for joining us for today's community chat. My name is Addie McClellan, and I'm filling in for our usual host, Bex Hayho. But I'm very excited to be joining you all today and guiding us through today's chat. Last month's chat was one of our Ask the Executives, where people submitted questions that our guest speakers at the time answered. And if you'd like to see that chat, it is up available on our YouTube channel. For today's chat, we are going to be talking about how homelessness impacts people with disabilities. In previous chats that we've done, we've talked with national experts about the intersections of health and homelessness. And those conversations were really focused on, well, how does homelessness impact someone's health? How do those two worlds intersect? And while today's discussion is related to that topic, we're going to be focusing a lot more on how people with disabilities are specifically impacted by homelessness, what vulnerabilities folks might be experiencing at falling into homelessness, what barriers might they experience when they are experiencing homelessness, things like that. So this discussion is something we're very excited to explore more with you all, and we're very excited to be going through today's topic with two local experts and our guest speakers today, Maggie Downs, the housing coordinator from the Dayle McIntosh Center, and Jordan Hoiberg, from the interim director of housing services with Illumination Foundation. So thank you both so much for joining us today. Just so we can get more understanding of what you all do and what perspective you're coming from today's chat with, I'd love to have you introduce yourself, what your agency is, and what brought you to this discussion. So Jordan, I'll pass it over to you to quickly introduce yourself to the audience.
Hello. So yeah, like Addie said, my name is Jordan. The agency I work for, Illumination Foundation, provides a number of services in the Southern California area. So we provide a number of CalAIM services, which I'll get into, that provide housing navigation and case management for people out in the streets or at facilities outside of our administration. We provide recuperative care, which is traditionally for people experiencing homelessness who are leaving the hospital with acute health conditions, or they would just end up back in the hospital if they don't have additional medical care. We administer emergency shelters, and then we also administer a number of different housing programs ranging from temporary rental subsidies to permanent supportive housing, which are, lifelong subsidies with ongoing supportive services.
Thanks, Jordan. And Maggie, I'll ask you the same question. Oh, Maggie, you're muted.
Whoops. Hi, everyone. My name is Maggie, and I am a housing coordinator with the Dayle McIntosh Center. Dayle McIntosh Center was established in 1977 by our young founder, Miss Dayle McIntosh herself. We are known as an independent living center, and there's about 500 living centers nationwide, with 28 being in California, and we are the only one in Orange County. We serve all of Orange County, and we support a community of people that want to live independently. Our mission is access and independence by and for people with disabilities. So over 70% of us here at Dayle McIntosh, we have a disability. So we practice what we preach, so to say. And I also feel like Orange County cannot be equitable if Dayle McIntosh isn't at the table. So thank you so much for this opportunity.
Of course, and thank you, Maggie and Jordan, for both joining us today. Maggie, I'm going to go back to you to sort of help us frame this discussion we're about to have. So for folks who might be new to this space or new to this type of discussion, what are some important concepts or terminology people should be familiar with before we fully dive in?
So the first thing to know when communicating with and about people with disabilities is you want to use people first language. So what that means is you emphasize on the person rather than the disability. So for example, when you use phrases such as a person has a disability, a person is able to use American Sign Language, rather than saying that person is deaf or he is disabled. You want to emphasize on abilities, not the limitations. You never want to use the word stating somebody is disabled or handicap. Handicap is such an old terminology that we don't even use anymore. And you also want to use, rather saying handicap parking or handicap bathroom, you want to say accessible bathroom, accessible parking. And we want to avoid stereotypes that say that suggest that, oh, they're a normal person, they're a healthy person. Instead say there's a person without a disability. So it's always people first.
Thank you, Maggie, for helping frame this discussion. When we are talking, and I mentioned it earlier, but I think in previous chats we've done, and when people usually talk about people with disabilities and homelessness, they talk a lot about, and in the community chat we did, I believe it was December 2021, we talked about how people experiencing homelessness might develop disabilities as they experience homelessness, how that trauma, that impact of homelessness can really shape someone's health. But Maggie, how are people with disabilities impacted by housing insecurity or homelessness? How they might be more vulnerable than some other community members? I'd love for you to help us unpack that a bit.
So there's definitely a growing income inequality. The National Institute of Health indicated that there's a 70% rise in income inequality with people with disabilities. On average, people with disabilities tend to experience lower socioeconomic status, and this is due to various reasons: lack of community support, lack of family support and understanding, discrimination. So there's at Dayle McIntosh Center, our average homeless consumer who has a disability may receive SSI income, which is about $1,000 a month, more or less. And it's my job as a housing coordinator to, give them options. What can I do with $1,000 a month? I'm in a bad housing situation. They may live in an area where that it's not accessible. We have people who use water hose instead of a shower because that's the only thing they can use. People who are living in a toxic living environment, just hanging by a thread, at-risk individuals who don't have a lot of housing opportunities. So it's my job to say, okay, let's think about this. We could add you to waiting lists for project-based apartments where your rent is based on your income, which is ideal, but it takes 3 to 5 years. How about renting a room? Well, renting a room is extremely hard. Not a lot of homes are accessible, for one. Number two is a lot of people who are renting out these rooms want people who are working, who are going to be out of the house. And that makes it very challenging. What are the other options? There used to be a time before, or actually during the pandemic, where there was vouchers available by the federal government that said people at risk of homelessness can get these housing opportunities, such as the mainstream voucher. But that opportunity was taken away during the pandemic. And so now it goes to literally homeless. And these are conversations that I have to have with my consumers, and it's not easy. It's very scary.
Thank you, Maggie, for providing that context. And hearing you talk about someone on SSI who has about $1,000 a month that they can live off of, when we are looking at housing prices in Orange County, the fair market rent for a one bedroom is about $1,900 a month. And when someone can, an affordable rent is considered a third of someone's income. So if someone on SSI only has $300 a month they can put towards rent, that $1,900 apartment is inaccessible to those people financially. So that's a really really important.
Yeah, exactly. And
Mhm.
there was a time where you could be on SSI. You could receive that SSI income. And I would say it's about 20 years ago where you could be on SSI. You could afford a 1-bedroom apartment at $600 a month, which took up a lot of your income, and it may be hard getting food, but you had shelter. These days, SSI income does not even compare, like you say, to the market rent rate. It's not even a possibility.
Mm, exactly. While we're still in this conversation of doing some level setting and really trying to understand, well, how are folks with disability impacted by this, I also want to bring up a term that gets talked about a lot in these conversations of homelessness that some folks on the call might not be familiar with, called chronic homelessness. And Jordan, I'll pass it to you to see if you could quickly and succinctly summarize, well, what does that definition of chronic homelessness, what does that definition mean? And just to provide some clarity for folks.
Yeah, so chronic homelessness is actually a definition set at the federal level in federal legislation. The last time it was changed was, I believe, the 2008 Hearth Act. And, the basic definition for chronic homelessness is that a person who is chronically homeless must have a disabling condition that is of long continued or indefinite duration that impedes their ability to live independently, and that their ability to live independently would be improved with a more suitable housing condition, and that person also has to have been homeless, right? So living in a place not meant for human habitation, an emergency shelter, or a safe haven for either longer than a year or for periods in the past 3 years, adding up to longer than a year. So there's that two components. One is disability related, and the other has to do with the length of homelessness. And that's really used to prioritize people for different housing opportunities. So a lot of those housing opportunities that involve permanent subsidies either have requirements that an individual be chronically homeless, or a preference for people who are chronically homeless. So, it helps prioritize people with the greatest need. The other potential downside is that you could have people with disabilities who are receiving fixed income and by definition aren't able to work and increase their income, and really aren't able to access these permanent subsidies until they've been homeless long enough to access them.
And Jordan, that was a perfect segue into sort of this next section. So I'll pass it back to you, but what are the unique needs of people with disabilities and people who are chronically homeless that should be taken into consideration, especially in terms of these services that you mentioned?
Yeah, so I think the first thing to keep in mind with that is that people experiencing homelessness or people transitioning out of homelessness are in multiple different types of environments, right? So for the street environment, so people who are living in a place not meant for human habitation, I actually received an email before this from somebody who is experiencing street homelessness, and gave me some pointers to bring up. He was mentioning specifically that difficulty accessing restrooms is difficult, that they'll sometimes have to deal with sweeps of homeless encampments, right? And that for people with disabilities, that it can be difficult for them to move their belongings or to lose the sense of community that they've built in a particular encampment or area where they're living. And so a lot of the times those difficulties don't necessarily go away when they're transitioning to a shelter environment. Most shelter environments are congregate living environments, right? Which might not be best suited for some people with mental illness or people with significant past trauma who, might not be able to deal well with people in that kind of constant environment where they're forced to interact with other people. And also they may not be able to utilize some of the coping strategies that they were able to effectively utilize out on the streets, right? Another thing that comes up in those congregate living environments is, durable medical equipment. So a lot of people, with disabilities need durable medical equipment for their disability. And, while people can bring it into the shelter, sometimes it can be difficult to utilize in a shelter. So for example, if somebody has sleep apnea machines could be rather loud at night, right? So while they could use it, it can be kind of disruptive to the environment to present difficulties for the person who needs that durable medical equipment. Luckily we are seeing a bit of a shift with COVID away from congregate living shelters, with Project Room Key and Project Home Key, which, is moving towards permanent supportive housing. There were some good experiments with non-congregate living environments. And then we see a lot of these difficulties continue as people transition into housing. So Maggie brought up some of the difficulties that people experience when trying to, locate a unit to utilize a subsidy at, right? Uh, our vacancy rate in this county is extremely low. When I looked last year, is about a third of what a healthy market is supposed to look like, right? And because of that, it's very hard to find downstairs units, and a lot of places aren't going to have elevators. A lot of the times people will need modifications made to their unit for it to be accessible for them. And sometimes they'll have difficulties going through the reasonable modification process with their property manager, or also affording those modifications. Just because you get approved for a reasonable modification, you still have to pay for the ramp or the grab bars, what you need to make that unit accessible.
Thank you, Jordan. That was thank you for going over all the different barriers that folks might be experiencing from, experiencing that unsheltered homelessness into shelters and even trying to access housing, how there might be barriers in place that make it difficult for people to physically even access the unit. Maggie, I'll ask you the same question. Jordan helped provide a lot of that context, but was there anything else you wanted to add about barriers people with disabilities might experience trying to access services?
Yes, definitely. I think the challenging part is even getting into a shelter, that whole process, because when somebody with a disability is at risk of homelessness, sometimes to get services, they have to be literally homeless before they could get certain services from organizations. So that makes it extremely challenging, where if, for example, I recently had a woman who was blind, had two little children, and we were trying to reach out to different organizations, and they wouldn't let her go into a shelter until she was considered literally homeless. And that's a big, and it's hard. It's hard to let somebody know who has a disability where they could be more vulnerable out in the streets, that they have to, go through certain uh, barriers before they could even get shelter. So that, and I think Jordan did address a lot of the difficulties just even being in a shelter, along with the health barriers. There's also people who have been victimized who have a disability. I've had people who say their stuff are constantly stolen or they're being ridiculed. And I know the shelter does its best to try to control those things, but it's extremely hard because people with a disability are extremely vulnerable in the shelter. So as long as with their health and then being victimized, it causes more trauma to the experience of being homeless and having a disability.
Thank you, Maggie, for sharing that with us. And I'm going to hop to a question that I think is a different order in the agenda, but it seems really relevant to the discussion we are having because, you both have brought up that accessibility aspect. And I know accessibility can mean a lot of things, from people being able to enter a building to even being able to have the resources or the forms they need to fill out made accessible to them. So Jordan, I wanted to ask, what work is happening in our community to help address homelessness or make these services more accessible for people with disabilities?
Yeah, so I think the most exciting thing happening right now was the rollout of CalAIM in 2022. And CalAIM is basically a form of in lieu of services for Medi-Cal. What that means is that there are things called social determinants of health, right? And example of a social determinant of health would be the food that you eat, right? If people don't have access to healthy food on an ongoing basis, right, that affects their health. They end up in the hospital more, it costs Medi-Cal more money. So the idea with in lieu of services is that by using insurance to address these social determinants of health, that it will save the insurance system money in the long run, right? And a lot of these in lieu of services with CalAIM are targeted specifically towards people experiencing homelessness. So they rolled out housing navigation. So if somebody is a Medi-Cal recipient, they could receive housing navigation to help them find a suitable housing arrangement. They can access deposit assistance to be able to overcome some of those barriers in getting into a unit, right? So that can, here in Orange County, pay for things like application fees, holding fees, utility deposits, security deposits, furniture. There's enhanced care management, which is a form of case management that really helps try to provide care coordination for clients. So it will help pull the different resources together to work collaboratively as a team and ensure that the client is appropriately accessing medical care that they need. There is recuperative care, so that people who have acute health conditions and are experiencing homelessness have a safe place to go. And then there's a step down now for recuperative care as well, to ensure that people can stay with the agency that's providing recuperative care longer until they're able to get into housing. And then we also see a bunch of different benefits when people are moving into housing. So one example for that would be tenancy sustaining services. So that's case management to help the person get settled into housing. There's medically tailored meals, which is 12 weeks of healthy meals tailored to the person's particular needs. So a nutritionist will meet with them and come up with a plan for them. There are environmental accessibility adaptations. So, I was mentioning earlier about having to pay for your own ramp to get into your unit. Now your insurance can help pay for that. And there are also, homemakers, which is like a bridge service while in-home supportive services. So caregiving services get put into place. And then there is another service that is supposed to be, sorry, I'm spacing on the name of this community support. There's so many of them, but is basically supposed to be in-home supportive services plus. And that really helps people with disabilities who might otherwise need to transition to assisted living, access to be able to stay into their home longer by giving them some nursing care in the home and more caregiving services. Beyond that, the state just released a $907 million notice of funding availability for mental health bridge housing, which is going to be bridge housing that is specifically combined with mental health care and resources. And, I think there are a lot of best practices being implemented by nonprofits as well. So our agency, we recently started the Illumination Foundation Medical Group, right? And that allows us to provide primary care, behavioral health, and dentistry out of our different facilities. So it really allows us to have a doctor or a nurse practitioner go work with these people where they are at. And that started out of our recuperative care, but we, were recently able to work with Medi-Cal to expand that for our housing programs as well. So we now have a doctor that will go do home visits with these people. And that will really kind of help us get an ongoing feel for what their needs are and provide the services that are best suited to their needs.
Thank you, Jordan. That was super helpful hearing all the different things that are happening at the various levels. As we wind down on the time that we have together, I wanted to ask you both, what resources are you aware of that do exist for people with disabilities who are experiencing homelessness or at risk of experiencing homelessness? And Maggie, I'll hand it over to you just to share anything that you're aware of.
Yes, thank you. So I know just recently the county did open up some Project Home Key accessible units for people who have sensory communication barriers, or for people who are physically disabled who need a special non-congregate unit. So that just started, I believe, about a month ago that they opened up these new units. So that was very exciting. And of course, us at Dayle McIntosh Center, we do offer home modifications, independent living skills. We're going to take part in the CalAIM program as well. So we could offer rental assistance, just like Jordan stated, all this funding for people to retain housing. So there's some things slowly but surely coming up that we could look forward to. And I believe Dayle McIntosh Center is just a great way to get started. We have housing workshops to educate the community on what housing opportunities are out there and how to conduct their own independent housing search.
That's wonderful. Thank you, Maggie. And I know that we're going to drop the link to the Dayle McIntosh Center webpage in the chat box for folks who want to learn more. And Jordan, I'll ask you the same question. What resources are you aware of?
Yeah, piggyback off of what Maggie said, I think it's important to highlight too that it's difficult for people to access services right now because of how fragmented the system is, where you have to reach out to different entities and then they'll often give you 10 more phone numbers to call that are other people that will then give you more phone numbers, right? So the best practice is what's called a no wrong door approach, right? And I think we're starting to move towards that direction in this county. So, for our individual coordinated entry system, there's now a bed reservation system for shelter beds that's bringing more shelters online with that. We also have that for our family coordinated entry system so that there is a no wrong door to get into shelter. And, I think we're making progress on that as a county. As far as current resources go, I think CalAIM is a huge one. An overwhelming majority of people who are experiencing homelessness will have Medi-Cal, right? Because they're usually by definition low income, and if they are Medi-Cal recipients, then they are able to reach out to their health plan and tell them that they're experiencing homelessness and ask what kind of resources may be available to them, so they could get connected to those resources like housing navigation, enhanced care management. Our agency also runs recuperative care. So if there's somebody who has an acute medical need, like cellulitis is a common one that people will see if they have big wounds on their legs or arms, let's say, then we are able to take community-based referrals for recuperative care now. So they can, call the recuperative care referral line and work with that referral line on trying to obtain a referral to recuperative care so they could get that medical care that they need. Beyond that, I think we see that no wrong door approach with housing too, with our coordinated entry system. So, I would encourage people to reach out to 211 to try to get connected to a specific access point that will continuously work with them to get them on the bed reservation system for shelter, and then also into the coordinated entry system so that they can try to access housing opportunities.
Wonderful. Thank you both so much for that insight. And I know we just have about 2 minutes left, but just really quickly, where can people go if they want more information about this topic? Either read studies or find out more about best practices, research, things like that. And I'll direct it to you, Maggie, to start us off.
So as far as best practices and utilizing people first language, CDC has a really great informational page on how we use people first language. So that would be really helpful. And then also going to the, oh my gosh. I know there's a little bit more information about the independent living centers here in California. They have really great information, but I do not have I don't know the website at the moment. So I apologize about that. But I think just, attending a lot of, I love these community chats that the United Way has, because you guys bring up a lot of information for people with disabilities that no other organizations that I've heard of bring up. So I think just by tuning into these community chats is also helpful as well.
Thank you, Maggie. And we can send out a follow-up email to the attendees on the call with that link, so we can make sure, Maggie, I'll follow up with you afterwards. And Jordan, just in our last 30 seconds here, what resources do you recommend or are aware of for people to learn more?
Beyond the United Way homeless advocacy trainings, I would probably start with your local city government, either attending a city council meeting or reaching out to your local government. They're going to be aware of the resources in your local community and the referral processes for that. Sometimes the cities will, directly employ outreach staff, right, who could go meet with people out in the streets to assist them as well. Just because I was mentioning the system's kind of fragmented, I think it's really important to start with a firm understanding of what your local resources are. And I think that starting with your city government is a good way to figure that out. If you want to learn more about funding and, kind of homeless efforts at the county level, the Continuum of Care Board meetings are open to the public, and they also have a number of subcommittees that work on particular aspects of our work.
Wonderful. Thank you, Jordan. Thank you, Maggie. And thank you all for tuning in and for your questions. There should be a poll that is popping up right now on your screen. This is just to let us know about what you liked about this chat, if this is useful information. So thank you both so much to our guest speakers for sharing this really important information with us and with everyone tuning in today. And thank you to everyone for giving us 30 minutes of your day to learn more and really understand what's happening and how our people with disabilities impacted by homelessness. We will send out a follow-up email with the links and all the different information provided today. And with that, thank you all, and I hope you have a great rest of your Tuesday.